I'm Christine Tyler. This is summer semester. July 9th, 2025. I'm performing a catheterization on a pretend person. It's my daughter's teddy bear and a water bottle. When I'd first come into my room, I would do hand hygiene, put on new gloves, introduce myself to my patient, ask my patient to state their name, date of birth, ask if they have any allergies, and then I would explain to my patient why I would be doing this catheterization. Usually, most of the time, it's for retention of some sort. I would explain why I had to do it. While I have my clean gloves on, I would get wipes. I would clean my patient vaginas around the thighs and around the leg and down the vagina with just regular wipes to make sure that the area is clean before I begin. Then I would take those gloves off and I would then clean my hands again with hand sanitizer, put on new gloves at that point. And then I would get all of my equipment, which would be my Foley catheter set, and I would begin to open it. This is a 16 French Foley catheter set. A lot of this stuff I wouldn't use just because I don't use it. It's not something that I usually need. I would then begin to open the sterile package away from me first, and then the flaps. Usually my area would be longer, so this part wouldn't be touching my patient at all. I would then take off my gloves and open up my sterile gloves. I would then glove my dominant hand first. Making sure not to put my hands below my waist at any time, because then my sterile field is no longer sterile. I would then grab my other glove and put it on my non-dominant hand. At this point, everything is sterile. I don't need this. I would just drop it, put it away from me. This is a pad that I would then take and stick underneath my patient's legs and vagina area. Here you have another pad that is cut out especially just for the vagina area, such as this. I don't usually use this. I find that it gets in the way more than it's helpful, so I don't usually use it. This is an iodine pack, and these are sterile sponges or cotton balls that I would use to clean my female patient. I would open this up, put it all over my cotton so that it was nice and saturated. I would then take my Foley. I would unravel this so that this is open. This is the part that I would insert into my patient. At this point, I would take this part and put it inside here so it could lay nicely. I would open this, which is some lubricant, and I would spray it into here to lubricate the end of my catheter so that it goes nice and smoothly into my patient. This here is just a 10 ml of saline that keeps the Foley catheter secure inside my patient once it's in. Still, everything here is sterile because it's on a sterile field. Now, once I have all this sitting in lubrication and everything's here and it's all waiting to be inserted, I would then take my non-dominant hand and I would spread the lips of the vagina open. I would take one cotton swab and go down the left side of the vagina, put this aside, put this one and go down the right side of the lips of the vagina. And then I would take this down the center to make sure that I got the meatus and down the labia. After that is done, I would make sure before doing all of this that my patient was in the right position, her legs spread, tilted back enough where I could see everything that I needed to see to access the point that I needed to get my Foley catheter where I needed it. Once all of it is clean, I would take my dominant hand with my Foley in my hand and I would look after spreading apart and placing the catheter into the meatus until I see yellow. Once I see yellow, I know that I'm in the right place. I see urine, it's filling up my container. I would push in about 2 more inches. After that 2 more inches is put in place, I would then take my syringe, place it on my adapter here, push my my saline inside, which would hold the balloon in place so the Foley catheter does not come out. After I do that, I would pull back to make sure it's nice and tugged. That means my balloon's in place and it's not going to go anywhere. So then I know that it's in place and it's okay. At that point, everything is set up. I would then take my lock here, secure it to my patient's leg, and secure everything nice and tight so it doesn't get pulled out. I would hang my Foley bag to the side of my bed on the hook, lower than my patient, so the urine would flow nice and evenly through so that gravity could help drain the urine. At this time, everything that I've done has been sterile until I hang my bag. Once I hang my bag, I'm no longer sterile with this hand because I've dropped it below the bed to hang it. But I'm done up here, so that really doesn't matter. At this time, I would take these gloves off, throw them in the trash, wash my hands, put on new clean gloves. Then I would come over. All of this would be hanging. This would be at my patient, and I would take all of this stuff. This would still be at my patient. And I would take all of this stuff away and discard it. I would make sure that my patient was comfortable, that they felt okay, that they didn't feel any discomfort. I would ask them if they had any questions. I would put their bed back down on low and make sure everything is secure, their bed alarm is on, make sure that they're okay, ask them if they need anything. At that point, I would secure the room, open the curtains back up, wash my hands, and I would exit the room. Thank you.